Effort to help new moms and their babies. You may have heard stories of mothers leaving their babies on the steps of orphanages, police departments, or fire stations. One solution that's been used around the country is the Safe Haven Baby Box. It allows moms to safely and anonymously surrender their newborns. A bill currently in the hands of our state Senate would help more mothers across North Carolina use baby boxes. But the bill has hit a snag with the organization that created the boxes. It's because of two words in the bill they say would eliminate the most used drop-off location. Natisha Lance is looking at the issue. It's tonight's cover story.
Family doesn't support the baby box bill being passed in North Carolina. Now, let that sink in for just a second.
That was Monica Kelsey, founder and CEO of Safe Haven Baby Boxes, delivering harsh words over TikTok to North Carolina legislators, currently in the process of passing a baby box bill. House Bill 139 will go beyond the Safe Haven Act by allowing emergency departments and fire stations to install temperature-controlled devices with a hospital-grade bassinet called baby boxes. Parents can surrender an infant up to 30 days old anonymously.
And until people stand up and start calling and letting them know that they do not want this bill to pass as written, it's going to pass.
The issue comes down to two words on page 2 of the bill, where it defines a qualified establishment.
House Bill 139 has the words on site, which needs to be changed to on duty.
Kelsey says using the words on site would shut down two baby boxes currently installed in North Carolina, Gates County and Ashe County, and possibly prevent future ones.
To put on site and mandate that somebody stays behind, it's going to eliminate every fire station in the state of North Carolina.
We reached out to Gates County Rescue and EMS, which has had a box for 2 years. In a statement, they told WBTV if the legislation passes with the way it is currently worded, then we will have to remove the box.
Fire stations are 95% of the locations that are getting our babies. 95%. And so they're looking at this and saying, well, we don't want fire stations.
23 states have baby box laws in place, including Tennessee, Idaho, and Indiana.
No state in America that has already passed a baby box bill has this language in it. We're trying to explain this to them. This isn't best practices. This isn't how the baby box program works.
The bill has already passed the House. It's currently in the Senate, where lawmakers tell us more discussion or revisions may take place. In a statement, State Representative Jennifer Balcom, the primary on the bill, provided WBTV a statement, reading in part, "The language requiring a qualified establishment be staffed on site 24 hours per day by an emergency medical technician or other emergency healthcare provider was carefully written to prioritize infant safety. The intent was to ensure that should a baby be surrendered in a life-threatening condition, immediate medical attention would be available without delay. The on-site provision was included out of an abundance of caution." Balcom went on to say the language came out of year-long conversations with local leaders, healthcare professionals, and emergency personnel across the state.
The box calls 911 whether anybody's standing in that building or not. They're going to send the next closest unit there.
Natisha Lance for On Your Side Tonight.
Natisha, thank you. Now, the Gates County Rescue and EMS chief said he has been in communication with legislators receiving mixed responses. Some say there is nothing they can do, while others say they're working on it.